Warfarin is an oral anticoagulant. The mechanism of action is that it inhibits the epoxide reductase, preventing the reduction of vitamin K to its active hydroquinone form. Now, vitamin K is a cofactor in the carboxylation of clotting factor 27910 and protein C. Indication: mechanical heart valves target INR depends on the valve type. Mitral valves generally require a higher INR. Second line DOACs, venous thromboembolism, INR should be 2.5. Okay? If it is recurrent, then 3.5 should be the target. In case of atrial fibrillation, the INR target is 2.5. So generally it is 2.5 only. Monitoring, you do the INR, which is the patient's prothrombin time compared to the normal prothrombin time. Warfarin has got a long T half. There is stable INR may take several days. So stable INR may take several days. What are the causes which can potentiate warfarin? This is asked. So liver disease can potentiate it. P450 enzyme inhibitor, very important, amiodarone and ciprofloxacin. These will potentiate warfarin. Cranberry juice, again this is an enzyme inhibitor. Drugs which displace warfarin from plasma albumin like NSAIDs. So since platelet function is inhibited by NSAIDs, so even NSAIDs will potentiate the effect of warfarin. What are the side effects? Most important one is hemorrhage. Second, it is a teratogenic drug. It can be used when breastfeeding, but it is a teratogenic drug and should be avoided in pregnancy. Skin necrosis, warfarin is first started. The biosynthesis protein C decreases, so that can cause skin necrosis. Temporary procoagulant in nature. The patient may have purple toes while on warfarin. Now, if the patient is on warfarin and has an emergency surgery, if the surgery can wait 6 to 8 hours, then you can give 5 milligram vitamin K IV. If it can't wait, then you give 25 to 50 units per kg. 4-factor complex, prothrombin complex. Stop warfarin immediately before the surgery. Most common questions which will be asked on warfarin will be the management of high INR. If the patient has got a major bleeding, then you have to stop warfarin and administer vitamin K 5 milligram and or prothrombin complex concentrate. If the INR is more than 8 and the patient has got minor bleeding, stop warfarin, give IV vitamin K 1 to 3 milligram. You have to repeat the dose of vitamin K if INR is still high after 24 hours. Then you have to restart warfarin when INR is less than 5. If the INR is more than 8 but there is no bleeding, then you will stop warfarin, give vitamin K 1 to 5 milligram, IV prep orally, and repeat dose of vitamin K if INR is increased after 24 hours. Restart when the INR is less than 5. When the INR is 5 to 8 and the patient has got minor bleeding, you have to stop warfarin, give IV vitamin K 1 to 3 milligram. INR should be less than 5 and you can restart the treatment. If the INR is more than 5 to 8, between 5 to 8, and there is no bleeding, 1 or 2 doses of warfarin can be given. Decrease subsequent maintained dose.